I think we've touched on it already, but really year one into the pandemic, we've all felt uncertainty, loss, and just so much that has really transformed our world and our lives. And so I'm really happy to be here tonight to talk about how we can connect kids to services in the state. But also wanted to touch on that there are some data points from the crisis text line that there has been an increase in anxiety in Connecticut and nationwide. And always, with this heightened stress, there is the heightened potential for suicide that continues to be present in all of our lives. And so we cannot ignore these signs, these data points, and what our kids are telling us, most importantly. And so I think that now more than ever, kids' mental health is critical to make sure that we are paying attention and really connecting to the services that are in the community to ensure that all kids in our state can thrive. So connecting to care, as you see here with our logo, is really focused on developing a strong system of care in our state. So Connecticut has a wide array of mental health services for kids in Connecticut, but really making sure that those services and other sectors like education and pediatrics, et cetera, are connected to each other so that again, kids can thrive, but also get connected to the services in a most timely manner. And so by coordinating access to quality care through a youth-guided and family-driven approach, we really make sure that there is an effective system of care across the entire state. So today, my colleagues and I are here to talk a little bit about some of the existing services in the community, answer questions, and provide support, and talk a little bit on the next slide about some of our ongoing work right now. So as I mentioned, Connecticut has taken a lot of strides in terms of ensuring that youth and kids in Connecticut get connected to services. However, across the infrastructure, significant gaps remain in terms of pediatric primary care, education, and behavioral health, really ensuring that all of these various systems are connected to each other. And so a lot of our work right now is focusing on supporting the communication and collaboration across child-serving systems to really make it easier for families to navigate services. Oftentimes, there are a lot of barriers that fall on families of not knowing where to go or maybe experiencing a potential wait list where maybe the service down the road has an opening, but they're not aware of. So making sure that those additional burdens don't fall on families and that it's really seamless to access these very needed services. And today we're going to highlight a little bit of mobile crisis, outpatient care, and care coordination services that are available to families. Again, I want to stress Connecticut has a wide array of behavioral health services, but these are some of the most common entry points and services that we really wanted to highlight, especially if there's an immediate need. So just beginning with care coordination, I'm just going to give a brief descriptor of what each of these services are. Care coordination really focuses on again, that system navigation so that families, especially if they're involved with multiple providers, don't have to, make sure that, they're providing all the information. Really, there's a care coordinator to help do that and wrap around the family to make sure that the family is getting all of the needed services. And they really work to identify family needs, but also family strengths as well, navigate and link to supports and services, and coordinate care and advocate for their needs. And this is typically done in a 6-month process. There's also mobile crisis, which is crisis stabilization, and this is available to anyone in the state. It's also available 24/7, 365 days a year, and it can be accessed by dialing 211. And I want to stress that the caller defines the crisis and setting. So if you believe that you or someone you know or your child is experiencing a crisis, then that counts as a crisis. There's no one to say, that is not a crisis. It is defined by the caller, and they will meet you where you're at. I also wanted to highlight that to move through the prompts a bit quickly, if you are dialing 211 and are experiencing, or someone you know is experiencing a crisis, please dial 1 and then 1 again when prompted, and it significantly reduces that time, especially as we know if a crisis is happening. It's critical that mobile crisis gets access as soon as possible. And then lastly, outpatient psychiatric clinics for children, also just commonly known as outpatient care. So these are our community-based, multidisciplinary team of psychiatrists, psychologists, clinicians, and other professionals that provide a wide array of behavioral health treatment to children, adolescents, as well as their families. And another thing I want to stress is that we really believe, when possible, that youth and children access services in the community rather than being sent to a residential facility or an emergency room, really connecting with these services in the community to meet their needs as quick as possible and as efficiently as possible. So next I'm going to turn it over to my colleague May, who's going to talk a little bit about some of the local services in your region.
Actually, Stephanie, if it's okay, my name is Jules Caliber. I'm also a network of care manager. Good evening, everyone. I'm going to actually go over some of the services in the area. We not only want to point out what the services were, but also kind of talk about what some of the local services are for the area. So there's a Boys and Girls Village, and they provide the outpatient services, as well as the care coordination services that Stephanie talked about. We have the Child and Family Guidance Center that's in Bridgeport, and they provide outpatient services, care coordination, as well as they're the mobile crisis providers for the area. Child Guidance of Mid-Fairfield, who we have a representative here tonight, provide outpatient services and care coordination. And we have the Child Guidance of Southern Connecticut with outpatient services and care coordination as well. Go to the next slide. We also want to just let you guys know that there's a lot of youth service bureaus. In fact, there's 12 youth service bureaus within the Southwest region. And youth service bureaus often provide an array of services and programs for youth development and positive youth growth. And these are 3 that are in the area, but there's a full listing on www.ctyouthservices.org, and that has a list of all the youth services throughout the state. And as Stephanie spoke before, the network of care manager for the Western region is May Cater, and Susan Cardillo Cunningham from DCF is also a great resource. We've included their contact information.
If we try to present all of the different services that are available, it would have been very long list and it's very, very complicated. So one of the things we promote is just outreach or a connection to any one of those agencies that we've identified. Again, the general process is you start with what we refer to as kind of the least restrictive or the least intrusive, if you will. So outpatient and any of the community-based services is a starting point. And mobile crisis is really important because they actually can come to the school or come to your house. And for mobile crisis, they tend to be one of the largest gateways into the entire mental health system, if you will. When we're not in COVID, we 90%, more than 90% of every call is received and done in a face-to-face visit within 30 minutes. In COVID, right now, we are doing face-to-face assessments, but it has to go through a COVID safety check. So if people have been exposed or anything, and families need to be willing. So we mentioned these 4 services because these are the definite best ways to get connected into the system, which is probably the #1 frustration that parents often face, particularly if it's a new experience for you. So contacting any of these agencies would be a good way to get connected. And if you may be in need of other services, so for example, we didn't go into any of what we refer to as the intensive in-home services. Intensive in-home services can get very specific to what the child's needs are and come into the family into the home to provide those services. So that's another whole part of the service array. So again, rather than overwhelming people with lots of details, we gave this very brief overview. And again, I think the whole team is here ready to answer any questions if people have any concrete things that they are interested in knowing about. So thank you.
Does anyone have a question?
This is Ann. I just thought I would kick off the conversation with the panelists about what should families be looking for, and especially those who, like you said, how can we normalize reaching out for help if this is a first time accessing services and resources, and again, we are all under tremendous stress and distress, and children are manifesting behaviors differently across the stress spectrum. So.
Sure. So thank you for the question, and I think we all might have, but Gail, I'm wondering if you want to start off with that.
Sure. So typically we look at if their functioning is being impacted. So is their stress or anxiety impacting their functioning in school, at home, or in the community? So sometimes it's a fleeting response to something that may pass on its own, but it also, if it becomes persistent and it is causing a family member, a parent or guardian to be concerned about it, or sometimes if the individual themselves, if a child is reaching out and saying, I just want to talk to someone, because we do get referrals like that with a child. It's not often, but sometimes it is. So really what we try to stress is if a parent is concerned about it and it seems to be impacting functioning, then reach out. And we always say we can do an assessment. And then sometimes the result of the assessment might be that it's normal kind of behavior, and we might make some recommendations. Other times we might recommend, individual therapy, family therapy, group, or, and then as Tim talked about, sometimes it would be a referral to a higher level of care if the functioning really seems to be impaired and there's a lot of concerns.
Yeah, I would add a couple more comments. Before COVID, generally speaking, just general prevalence rates about children's mental health. Generally about 10% of the population of children and adolescents experience what we refer to as a serious mental health issue. And generally in an average year, about 20% might experience some kind of behavioral health, mental health issue that requires them to seek professional help of some kind. In COVID, estimates are coming in from across the country in a wide range of exaggerated numbers. So we've seen increases in anywhere from another 20% to potentially up to 50% of all kids having some kind of experience. The most common in general, again, before COVID, depression, anxiety, attention deficit, conduct, those are the most common. Depression tends to have historically been the most common. During COVID, we're seeing anxiety outpace depression. And one of the things that we are suggesting is do not assume that your children, grandchildren, your loved ones who are children are okay. You really need to be very deliberate and intentional to check in with them, connect with them, and be sure that they're functioning and doing well. Because kids will mask their behavior. They're very often embarrassed or stigmatized and feel stigmatized if they were to bring it to people's attention. So it's one of those times, and we feel like it's really important to just reach out and be sure that your children are doing well.
Tim, you mentioned, sorry, I was just going to say, you mentioned the term grandparent, which is something I think about a lot. Who can help children before there's a crisis? Obviously, pre-COVID, school workers were often the first line of defense, but I feel like everything is different now. Could you talk a little bit about how someone who is not a custodial parent, like what they might do or what they should do?
Yeah, there are lots of people who are very important into children's lives, and essentially any adult that they have routine contact with becomes kind of a surrogate caregiver, if you will. We try to be really acknowledge that with folks who are in those roles. So oftentimes coaches, religious leaders, scouts, after school activities, they underestimate the potential influence and connections that they have with kids. And so if you're in any of those roles, it becomes really, really imperative. And often those are the things, those are the people that children will reach out to. Often, unfortunately, for all of us with children, sometimes our kids just don't feel comfortable turning to us. So another trusting adult becomes really, really important. And the other piece I would say is, even in those additional roles, then again, we might all fall into those too, if we're aunts and uncles and grandparents, and is to, again, like the parent or the caregiver, not take for granted that those children we have contact with are doing okay. Be deliberate and intentional to check in and say, hey, we've been in this COVID thing for a year now. How are you doing? What's your friends doing? How have you had contact? Engage them and go a little bit deeper, and don't be afraid to just ask. Do you find yourself more depressed or turning inward? Do you find yourself more anxious? Are you worried about your friends? Are you worried about your family? It's really important to engage. So I would say that I would invite any of the other members to weigh in on that also.
I would also add, you mentioned their friends. A lot of times the peers are more aware of what's going on with their friends, and really encouraging children in general, if they hear something from a friend, to tell a trusted adult and not just keep it to themselves. We often find that's where some of the calls are coming from. That's how things are getting recognized, because one student told another student, and then, finally a student spoke out. So really educating kids about how important it is if they know of somebody who is talking about hurting themselves, killing themselves, things like that, to make sure they're reaching out and getting help of an adult and not trying to solve that problem on their own.
I think another thing I might add too is, as from the adult side, as anyone who might be a trusted adult, to really also model what taking care of your mental health looks like. Whether that be, self-care and, just, really making sure that you're modeling those things as well, because I think that the pandemic has really caused an impact on all of us, and making sure that we're all responding as healthy as we can, and really making sure that when we have kids in our presence, that they're also seeing that.
I would also add that having two children who are far away from me, and the virtual world is the only way to connect with them. As Tim said, get deeper into those conversations. And if kids don't want to be on camera, ask them just to turn the camera on just for a few minutes, because sometimes we'll notice something physical about them before they say anything verbal. You can tell when someone's not feeling right. They're dressing different. They're not combing their hair, or, if a young woman before was putting on makeup every day and now she just isn't doing that, there's more to that than just, I don't feel like putting makeup on. So there really is. And then if they do open up to you, don't catastrophize it. Don't like, oh my God, like we have to have our own set of tools to, remain calm and try and help them get to the resource that can provide that clinical intervention for them. So even we need the resources as well, someone to talk to get those tools from. And at the department, we try and not just focus on the children, but we do a lot of parent coaching and parent education and parent support groups. So there's lots of resources that we have as well to offer parents.
I think that's so important, Susan. I'm glad that you brought that up, because I know some parents are nervous on how to approach this with children. I know Tim gave some good suggestions, but you also have, kind of age appropriate things. discussions that you might have with your, like I said, I have teens that, have their own activities, or, the sort of middle schoolers and grade schoolers. Those conversations are different. But I think, how I've tried to approach, mental health with my children is normalizing it. This is something that is, everyone faces to some degree or another. And this is totally normal, and realizing that there is help and they're not alone. And I think the problem that I see with teens, one of many, I'm sure, is that they really feel like they're the only ones. And I think that's what just makes it even harder for them. So I would love to kind of explore about how, parents can get that support to have those conversations and talk about it, and how that they can help normalize it for children.
Yeah, I think that's a great question. We have a saying, you can't give what you don't have. And so it becomes really imperative for adults to take care of their own health and mental health. And so probably most of us, or many of us, have somewhat intuitively developed what we would refer to more formally as a mental health plan. And what a mental health plan is simply, if we're stuck at home doing the virtual work from home, school from home, et cetera, we say, gosh, we need to be sure we get outside. We need to make sure we exercise. We need to make sure we eat well. We don't want to overeat. We don't want to undereat. We need to monitor how much we turn on the news and monitor the death rate of COVID. We need to turn off the TV at times. We need to engage in other activities, both social, emotional, and physical, that we might not otherwise normally do. So that when we do those things, and we do some of that intuitive, we need to do that with our family and include our children. And so we need to create those, and to talk out loud specifically about doing it, and being deliberate and intentional. And again, it's particularly, there are some developmental age stages that are difficult to do that. That middle school period is really, really tough. The early high school stage is really, really tough. And so becoming the voice of that middle school student whom might not feel comfortable voicing what they're going through is important for a caregiver to be able to say, gosh, well, some kids your age might be experiencing X, Y, and Z. When you get a little bit older into sophomore, junior, senior year, they might be a little bit more expressive, but in those age grade, they want to be with what their friends are doing. And guess what? Their friends are probably struggling with the same thing. So the last thing I'll say on this point, because for the grade school kids, there's a great resource out there, and we probably should add it to our slides. And it's called the Gizmo's Pawsome Guide to Mental Health. And Gizmo is a comfort dog that's famous in Connecticut, and he's around all over, and he has a large following on Facebook, I think over 300,000 fans. But in that book, it walks kids, and again, it's really appropriate from anywhere from first grade to 6th and 7th grade is most common. You can get the older kids to engage, but that middle group is, again, tough. And it's animated, but it walks kids through how to create their own mental health plan. But in it is a companion for a trusted adult. So the trusted adult does it with the child. So it's a perfect thing, again, for grandparents and grandchildren, aunts and uncles, and again, parents. Again, there's some age groups where it just doesn't work well for, but it's based off on an evidence-based model for adults on what is really good for maintaining health and wellness in times like this. So it's another resource that could be available for folks.
Tim, I just dropped it in the chat if folks want to check it out.
I would also add to that, Tim, another resource that comes to mind right away that offers a lot of online literature and webinars is the Hub, which the website is thehubct.org. I subscribe to their newsletter, and I get great resources every week. Like this month, they're talking about teenage drinking, and a lot of the material is geared towards parents and how parents can, fill up their tool bag with interventions for their children. So I think that's another great resource as well.
I would like to give a shout out to Vincent Russo, who we didn't introduce, but he's here with us from Connecticut DCF, and also our colleague, Representative Jonathan Steinberg is here with us from Westport. So we're collectivizing the resources so we can spread them out. I wanted to also speak to what Lucy said. How do we practice saying, I'm so glad you let me know that you're struggling, whatever that looks like. Just practice that and recognize that oftentimes children are trying to protect parents. If parents are stressed, especially economically stressed, unemployed, you know, poverty, parents, like you said, I mean, children will often try to mask their own struggles because parents are struggling. So how do we create an openness without having that child really do the emotional work of taking care of the parent, and you know, open up those channels for the secondary trusted people in your life? How do we open that up? And it might be a little contrived, like, you know, let's set up a call with, you know, your godmother or something that you haven't talked to this whole time. So those couple of things.
One of the things that's been very popular at Mid-Fairfield, we always offer parent groups, but during the pandemic time, we've had record numbers of parents attending the parent group, and it used to be more curriculum based, but nobody wants to talk about the curriculum. They want it open-ended, and they want to be able to talk about how hard it is to be a teacher and working from home and the parent. And so they've really supported each other, which has been nice, and normalized it for each other. And in all of our sessions, when people are participating in Mid-Fairfield, a caregiver is always involved in that. So many times the sessions are just with the parents, so they have an opportunity to talk about their own struggles without the child. You know, when it's virtual, it's a little harder. They have to find a private room where they can kind of talk. And but we've definitely noticed a lot more parents needing the support than the children, in addition to the children, but the parents are really reaching out.
I'd like to add a point. I don't want to scare people, but I do think it's important. I think we've a couple people have made reference, but situations like this, we do worry about suicide. And in the state of Connecticut, on average, unfortunately, for children 18 and under, we average about 8 deaths by suicide every year. The suicide prevention field is very, very worried about an increase in death by suicide. In Connecticut, so far, we have continued to see the same number of average deaths. Again, 1 death is too many. That said, but we had a wake-up call last year. Going into November, we had 3 or 4 deaths. We had 4 deaths in October, and we finished the year at 8 deaths. So we got through 3/4 of the way of the year under average, and we finished on average. Suicide by nature, one of the dynamics of it is if I'm miserable with people around me who are miserable, I'm probably pretty much okay. But when people around me start to feel better and I still feel miserable, that's when I'm most at risk. Springtime in general is an increase in suicide. And as we start to recover to more face-to-face time in a variety of our activities, as people start feeling better about that and vaccinations go up, we should be really hypersensitive about those kids who are left behind not feeling like they're recovering and feeling better. That's why checking in becomes so, so important. And just being able, and if you know you don't have a comfortable working relationship with your child, is to be sure they're surrounded by people that they can talk with, because it's only in that connection that you're going to really get to know. And again, there's multiple opportunities for different ways to be more comfortable approaching your own children or other children around that. QPR is one of the best trainings. You guys have some great trainers down there. The hub offers fairly routinely, I believe it may be fairly almost weekly, I think, that you could participate. And one of the number one things that QPR, like CPR, it's literally was designed, is to be comfortable being just asking people directly, are you thinking about killing yourself? Are you thinking about hurting yourself? So I just, again, not to alarm people, but not to talk about it is also not fair, because we are worried, and we do worry about an increase, particularly in this year, as we start to feel better about returning back to more normalcy, if you will.
Tim, I think you raised a really good point there. And I know in the legislature, we're talking about two different bills regarding school-based mental health clinics. What sort of role do you think that these school-based mental health clinics will be able to help kids maybe who are at risk for suicide, particularly once we do get back to normal, like you're talking about? And, you know, kids start seeing the sort of day-to-day reality and the hardness of getting back and getting back to life.
Right. So school-based health centers are fabulous. I worked in a number of them for about 4 years, so I love them. But there's 206 districts in Connecticut, school districts, and there's almost 3,000 different school buildings, and we have 96 funded school-based health centers. So it gives you an idea about how many we have as compared to what the need is. So there are fabulous, and if you are fortunate to have a school-based health center in your school or in your community, that's great, and they're definitely a great resource. So I would not underestimate your connection to the school-based health centers. That said, if we go back to the Gizmo book, one of the things the Gizmo book does, it is ask every kid, this is why it's a really cool experience for kids to have this book. It asks every kid to identify whom a trusted adult is in their school. And they literally are required to name them. And if they're not sure that the trusted adult whom they name knows, there's a little activity where they could literally send a little note, like a Valentine's card, to that trusted adult saying, hey, you're my trusted adult. And that allows and keys the trusted adult to realize that they're special in that child's life. You can imagine there's a lot of favorite teachers, and they tend to be the winners of a lot of those kinds of things. But it is really important. And again, you don't need the book to make a decision like that. You can, as a caregiver and as a parent, you can ask your kids who it is. Who of all the kids, of all the teachers in your school, who would be the one you would be most likely to go to and talk to, and have them talk it out. And then you can say the same exact thing of all the adults in your life, including your aunts and uncles. Who are the ones that are you most comfortable with? So what you're doing is you're actually getting the child to practice who it is they might reach out to. So the point is really well taken about school-based health centers. I do not want to underestimate their value, because they're huge. They do so much. But again, if you just measure what they're available to versus what the need is, it's just, it's a little bit just a disconnect there.
I have a question, but I definitely want to encourage everybody in the audience, if you have any questions, raise your physical hand, raise your Zoom hand, put it in the chat. We definitely want to hear from you. But I have a question that's very much in the weeds. And I think of my adult friends who often talk about, oh, like my therapist wasn't a good fit, and they try 2 or 3 or 4. And I'm just curious, what happens if the intervention is not the right intervention, but you know your child still needs help? Can you talk through how parents might deal with that? And then when we're done with that, Francis, I see your hand. We'll go to you next.
So I'll give a quick answer on this one, but I'm going to turn it over to Gail and again, anybody else. I was trained as a child clinician, and one of the things I love about children don't fire their clinicians like adults do. Children will stay and hang in with them, and they will give the message that they're trying to communicate over and over and over again. Now, that said, I'm sure there are some exceptions to that, but children are much more tolerant than adults. So I'll leave it at that, but I'll turn it over to Gail to see what she would like to say.
So sometimes it isn't a good fit, but sometimes you also have to look at what the services are. So a parent may come in thinking, oh, my child needs individual therapy, and that's what they think they need, and that's all they want. And then a clinician might do an assessment and determine actually family therapy is what's needed, or some parent guidance and individual and family. So sometimes what the parent's idea is may not necessarily be what the recommended treatment is. Uh, and then there's other times when they may start with a treatment, and then it might be determined that maybe that type of treatment is not the best fit. So maybe they're going in the office, and the therapist might determine that in-home services are more appropriate because the family's having transportation difficulties and it's becoming too cumbersome to drag their 3 kids to the therapy appointment. So there's definitely flexibility, but I always recommend parents start, they could make the call, and then we could help determine what is the best fit. And sometimes they'll step up to a higher level of care. Sometimes they'll step down to a lower level of care. So they might be in intensive therapy and they may not need that. So they may just get once a week therapy, or maybe a group is more appropriate. So really it's in conjunction with the family to help determine what's the best fit. So the family has their ideas, the clinician can make their recommendations, and then usually the decision is made together.
Many things in our healthcare system come down to money and insurance. And we've heard a lot about free services, but I wonder if you can give the audience a sense of, what type of interventions are free, what type of expenses or what type of insurance they may or may not need, who's eligible, who isn't. Just give us a little lay of the land as much as you can in a few minutes.
Yeah, so it is a complicated question. It's also one of those things that's complicated by the large variety of services that are available. But in general, just about every service has at least a handful of what we've refer to sometimes as community slots. In other words, almost every provider has some capacity to work with some folks that may not fall exactly into that insurance category, if you will. So just to be explicit about some of them, mobile crisis, anybody in Connecticut, regardless of insurance, can engage. So that's always there. Once you get into the outpatient, you'll get a variety of insurances. Again, if it's Medicaid, most every one of the public outpatient clinics that we, like Mid-Fairfield, that Gail oversees, will take Medicaid, and of course would take a lot of the other commercial insurances from Connecticut. So those are pretty common. And as the intensive in-home array, again, a lot of those are varieties. Some of those are covered by Medicaid, some of them are not. Some of them you can bridge between different ways being taken care of. So it's really hard to give a generic answer to that question. But what we would say is, again, those agencies that were on the slide, if you don't know, engage with them, call them, and they'll help you walk through that about what's available and what's not, and what insurances will cover and what doesn't. And at the last, always call mobile. Mobile crisis can always come to your house, can always engage. And then again, they can help you. They're able to stay involved with up to 45 days in order to link you to the best, most appropriate longer term service. So it's just another, again, it's often the gateway into the system that's really helpful. So that's probably the best. But again, Susan or others, if you want to add anything, please feel free to do so.
That gives us a great segue into several of the legislative policy initiatives that we're undertaking this session in the wake of this pandemic. One is to extend telehealth, because we've seen how incredibly important it is. And
Rep Hughes, you froze, but I see Nita has a question. So let's go there. And Rep Hughes, when you come back, well, Nita. Go ahead.
Hi, my name's Nita. Actually, I'm a graduate
social provider. So we have that. We also are, again, in human services, looking at expanding Medicaid coverage and eligibility to 201% of the federal poverty limit. Medicaid and Husky does cover some of these behavioral health needs and services. And I thought maybe I give a shout out to Representative Steinberg, who's head of chairing public health, and seeing if he has any other legislative initiatives around this that he wants to highlight.
Rep Steinberg, can I hold off and let Nita finish her question first? Thank you.
Yes.
Sorry, there was internet
Yeah.
for a second. I'm a graduate social work student, and actually my colleague Jocelyn is here as well. We're both interested in youth mental health, and this is just a broader question that I think a couple of you have alluded to, but we were just wondering, you know, really what is legislation doing to kind of address the need, especially with COVID? And in particular, we're interested in a bill that I think came out last month in the Senate. I think maybe some of you have heard of it, Senate Bill 2. It's an act concerning the equity, safety, and health of children. And it's pretty comprehensive in dealing with some of the issues that COVID had brought up, the increased, need for mental health services in youth, and kind of more collaboration, especially in virtual environments. But we're just wondering if that's a bill you've heard of, if you anticipate there'll be any obstacles to getting that through, and if that will, how you think that might help.
I can say I don't know that bill, but
I do. So hi, I'm Vinny Russo. Thank you. I think Rep. Hughes mentioned me earlier. I am the legislative program director for DCF. So that is a bill that we are familiar with and tracking. And a bill like that does have a lot of different components to it. And some of the components we're looking at right now and talking it through with policymakers. I think there are some obstacles as far as costs associated with that bill. And, and with most legislation, it's really the details of the language you really have to look for. So that's something that we have been working on closely with the Senate leadership, and hopeful that as the bill moves through the process, we'll be able to get some appropriate amendments that will make that bill more appropriate for what it's really driving to do, which is trying to ensure that access to services are available to everybody. And what we're here to tell you today is that, we're pretty proud of the service array that Connecticut has built. I mean, across the country, we are envied for our behavioral health services for the youth in Connecticut. States, we talk to other states all the time about what we're doing and sharing our strategies and our efforts. And so we plan to continue that and continue to work with our legislative colleagues to ensure that the best policies move forward for the state.
Rep. Steinberg, do you want to have the final word of any other legislation?
I'll just say that we started the session in the Public Health Committee with high expectations, as always. We had a bill on suicide prevention that we thought would move things along, and we tried to create a new working group, and the pushback was that we were, if anything, diminishing the importance of young people in that context. So we decided not to reinvent the wheel on that one. We have a mental health and behavioral health bill. We have a bill on recruitment and retention, which is very important because we want to make sure there are an adequate number and quality of mental health and behavioral health professionals in the state. So we think that's something that's very important. I forgot what the fourth bill. Oh, we have a telehealth bill, but again, even though we don't really have much going on there, one of the key insights we had is that it is such an effective tool for young people, oftentimes who are more comfortable in the home setting than coming into a doctor's office. So stay tuned on that. I think there's more to talk about with regard to telehealth. I'll leave it at that.
I'd just like to follow up on something that Rep. Steinberg just mentioned, because I think it's important. During COVID, the department really worked hard to make sure that our behavioral health services stayed moving for the youth families that needed it. And, we never closed our doors. We worked with our partners. I mean, Beacon Health is a phenomenal, CDA, everybody on the call are just phenomenal partners with us. And it's important to note that while DCF manages and coordinates those efforts, it's really the folks in the community that are delivering the services directly, and we couldn't do it without them. And that they take their time out of their night to spend with all of you and explain the process is just, it just shows how selfless they are when it comes to this work. So I just want to say thank you to everybody for letting us kind of get the word out. You know, due to COVID, children's behavioral health it's really in the forefront, which is, it's a great opportunity for us to talk about the services that we have and to bolster those for the future. And so I just thank you for the opportunity to have the team here and discuss it.
And could I just add one thing? I really appreciate that, talking about the providers. And as a nonprofit agency, one of the things that's really important is for us to continue, they brought up retention and hiring, and it becomes increasingly difficult to maintain quality staff with the funding that we receive. And the nonprofit funding has been flat for a very long time with our contracts, and it becomes increasingly difficult to continue to deliver quality services when a social worker can go work for a school or work for the state, and what's going to bring them into our nonprofits, and our ability to pay them a competitive salary is increasingly difficult. So I just wanted to add that. Thank you.
Thank you, Gail. Thank you, Vin. Thank you, everyone. I don't want to be the official closeout, but I so appreciate people taking time to join us. I know I feel, I don't know, hopeful might not be the right word, but it feels like there is a wide network out there. And as Vin said, not every state has such resources. So I hope parents will avail themselves, grandparents, aunts, uncles, caretakers, workers, anything you can do to help our young people find a lifeline will be appreciated.
Thank you, everyone. This is great, and I appreciate everyone's time. And just wanted to let you know, we are going to be sending the slides to everyone that has registered for the event, that has all the numbers of the resources, and so that you can follow up as needed. And you are always welcome. We'll also include our emails so that you can reach out to us if you have any specific questions on ways that we can help you.
Thanks everybody for showing up and for your service really to the wider community. We are also going to post this whole forum in some sort of packaged way, I guess, to maybe our respective legislative websites, or somewhere where you can share it with your community or friends or family members, so that we can go back and get some of these resources. I think that as legislators, it's also our obligation to fight for the resources, to invest, like you're saying, in the nonprofits and so forth. We were just all on a call this morning with home care agencies, same kind of thing. We need to make these resources visible, and we need to fund them. And we may need your help in making that case to the wider community, because that's what your tax dollars are going towards. And I can't think of anything more important than our state's youth, and meeting them in the wake of this pandemic with increased distress, to have the services there and the expertise to meet the need. So thank you, and we'll fight for you.